Hello everyone, welcome back to our channel. Today on Parenting Series, we'll be looking at a topic that is often overlooked but incredibly important, and that is how to spot depression in kids. So in today's video, we'll be looking at signs and symptoms, causes, effects, and how to manage depression in kids. So I'll encourage you to watch this video to the end. Welcome and thank you so much for taking our time to click on this video. According to statistics from World Health Organization, about 1.1% of children under the ages of 10 to 14 years of age and 2.8% of children within the age range of 15 to 19 years of age has been depressed at one point of their lives or the other, and 1 in every 6 Nigerians has undergone some form of depression. So it is crucial to recognize this sign early enough and provide the necessary support and intervention. This is vital for the overall well-being of the child and the quality of life. I know it could be quite challenging to identify depression in children because they try to put up masking behavior or concealing behaviors. They may try to hide their feelings or struggles, thereby making it hard for parents or caregivers to notice any changes. Also, there is often lack of awareness about childhood depression, making many cases or many situations to go unnoticed. Now, let's delve into the signs and symptoms of depression in children. So you look out for behaviors such as irritability. This is when the child gets annoyed frequently, and anger outbursts. If the child gets annoyed, he begins to shout, scream, insult people, and go as far as destroying properties. We also have lots of interest in the activities that the child once enjoyed doing without being compelled to do, and the child that was always happy being around people all of a sudden wants to be on his own, wants to isolate himself from every other person around him. That could be a sign that that child is going through some sort of depression. Then if you notice also mood changes, at one moment he or she is extremely happy and excited, the next moment the child is so sad and wants to be left alone. Or you notice change in sleep and eating pattern. A child that used to eat very well suddenly prefers to eat little quantity or doesn't even want to eat. Or a child that would normally sleep well, but now the child is struggling with sleep, finding it very difficult to sleep, prefers to stay up late or just to stay awake, and you can't really explain the reason for that. If you notice a drastic change in the academic performance of the child, for instance, a child that was doing exceptionally well, coming back with good grades, suddenly there is a drop in the academic performance of that child, that could be an indication that the child is struggling with something emotionally. So these symptoms could be caused by a variety of events or issues ranging from family history of depression or mental illness. It could also be caused by family difficulty or a child that has been abused emotionally, verbally, sexually, or physically. Then you have cases of chronic illness like epilepsy, diabetes, asthma, or even very severe pains. Other causes could be stressful events such as separation of the parents, divorce, or death in the family. There are also cases where the child is being bullied or having troubles with school and other classmates or his schoolmates. And there are also extreme cases where the child is being exposed to alcohol or drug abuse. And other causes could also arise from a child having some sort of anxiety disorder like ADHD or OCD or even conduct disorder. All of these could lead to a child presenting different symptoms of depression. So if you notice one or two of these changes, or if any of this event takes place, please take notes of this and get to know how the child is reacting or behaving in reaction to any of these causes. So the effect of depression in children can be widespread and impact on different aspects of their lives, ranging from their academic performance, social life, low self-esteem, and there could be chances of developing other mental health conditions, and also a risk of being exposed to substance abuse. Now, some of them may go as far as inflicting pains on themselves, that's harming themselves, or developing suicidal thoughts, or even going to the extent of committing suicide. So when you have children reading some materials that they are not supposed to read, or making some statements that are suicidal, or asking questions about how to kill themselves, or asking questions about life generally, or what it means to kill themselves, or engaging in some sort of discussions that you are not comfortable with, this should give you cause for concern, not to look away, but to follow up with the child and know exactly what that child is up to. If you notice any of this in children, please do not leave them alone. They shouldn't be on their own, because anything can just happen. So you need to pay close attention to them and try to monitor what they do. Okay, so to manage depression in children, please seek for professional help. Get to meet a therapist or a counselor for proper support and intervention. Also seek medical help, where comprehensive evaluation will be done, medications given, and in some cases refer to a specialist for monitoring and necessary support. Also inform the school authorities, the counselor, and the teachers about the child's depression, and work out a support plan through providing educational materials or creation of a support group, just to help that child to thrive in school. I would like to stress a little about verbal abuse. You may be a parent. What do you say to your child? You may be a teacher. What do you say to your students? You may even be a caregiver or a guardian. What are those words you use on the children under your care, especially those that are not performing very well at the moment? I'd like to wrap up this video with a story about Thomas Edison. While he was growing up, on one of those days, his teacher gave a note to him to take back to his mother. On getting home, Thomas Edison handed over that note to his mother and was curious to know what the content of that letter was. He asked his mom about what his teacher wrote on that letter, and his mother read out to him, "Your son is a genius. This school is too small for him and doesn't have enough teachers for training him, so please teach him yourself." And she swung into action, decided to homeschool him with so much devotion and dedication. Years after she passed, he was one of the greatest inventors around the world. So one day, he found the letter among other items while he was arranging some things, and he went through the letter. The letter read, "Your son is mentally ill. We won't allow him return to school anymore." Now imagine for once that his mother gave up on him because of the notice from the school. The world wouldn't have been privileged to have someone like him who invented electric bulb that we are all using today. So words are very powerful. Be careful of the things you tell your children or little children around you, because if they reflect on these words, it damages their self-esteem and can bring them down completely. So as parents, caregivers, and educators, we have the power to make a difference. By being aware of the signs and symptoms of depression in children and taking proactive steps, you can help a child assess the support they need to thrive. So let's create a safe, supportive, and non-judgmental environment for our children to open up and seek help when needed. Thank you so much for watching. I hope this video has provided you with valuable insight to support the children in your life. Kindly subscribe if you are yet to, like and share with your friends and family, and also turn on your notification bell to stay connected to this channel. I'll see you in my next video. Bye.